Good evening. Welcome to your doctor's appointment. I am Dr. Shea, and I will be giving you your cranial nerve examination tonight. So throughout this examination, if you feel any discomfort whatsoever, please do let me know. Okay? Okay, very good. So first, let me put on my gloves, and then we can begin. All right. So how are you feeling today? Yeah? Good. So overall, pretty good? Okay. Okay, very good. Before we begin, are you allergic to anything? Okay. Perfect. Yeah, that won't be used for this examination. So, but perfect. All right, so first things first, let me go ahead and take your pulse. So if I can just have your wrist, thank you. All right, very good. Your pulse seems very normal, and I was actually counting your respiration at the same time, so that was also very normal. And then real quick, I'm just going to do a little head and physical appearance just to make sure everything is looking normal as well. So physically and appearance-wise, you look very healthy and well-nourished. Okay. Your skin. Okay, good. It's soft and intact. And dry. Perfect, which is normal for your ethnicity. And then I'm just going to look at your face. Just make sure that everything looks symmetrical, which is very good, and it does. And now I'm just going to touch your scalp and your hair. Okay. Good, your hair feels soft. And now I'm just checking your head for any normalities or bumps. Let me just get a little bit closer. Okay. Do you feel any tenderness anywhere? No? Okay. Very good. All right. Very good. And then real quick, I'm going to check the sinuses on your face. Let me know if you feel any tenderness at all when I check them. On the sides here. Okay. Side. Any tenderness? Okay. Very good. Very good. So I'm going to check your jaw right now. I'm going to just put my hands on the side here. Can you open your jaw? Okay, close it. Now clench. Very good. Do you feel any pain at all? Okay, good. You open, close, and clench. Okay, awesome. Very good. I didn't feel any popping, so that's very good and very normal. All right, so now I'd like to test your nostrils. So if you can plug one side, very good, and breathe in and out. Very good. Now plug the other side. Breathe in through your nose and out. Okay, very good. And now I'm going to quickly look inside your nose. Okay. You just let me know if you feel any pain, okay? Okay. Okay, very good. Now the other one. Okay. All right, okay, very good. Your nose is very moist and pink. I didn't see any lacerations. Did you feel any pain or tenderness at all? Okay, very good. And now I'm going to feel your ears. So I'll just start with your left ear. Just going to feel around the outside. So let me know if you feel any tenderness at all. Okay, I don't see any lacerations or bumps or bruises. Okay. Okay, very good. And now I'm just going to look inside your ear. Okay. Just a little bit of earwax, but your eardrum is a pearly gray. So that looks very, very good. I'm gonna feel the other side. Any pain or tenderness? Okay, yeah, no lacerations or bumps or disfigurations. Awesome. And now I'm just gonna look inside your right ear now. Okay. Yeah, there's less earwax on this side. Awesome. And your eardrum is also pearly gray as well, which is very good. And no lacerations on either side, no blockages, so that is very good. All right, now if you can open up your mouth so I can look inside to make sure everything is all right in there too. Okay. Okay. All looks good, clear, moist, and pink. If you can lift up your tongue, please. Okay. Looks the same, very good. And then can you stick out your tongue for me, please? Okay, in the back there. Okay, good. Awesome. Okay. All right, you can close your mouth now. Thank you. Okay, everything looks normal as well. All right, so now I'd like to look at your eyes and just fully examine them. And they both look very good and symmetrical and even. Nothing standing out or looking abnormal. So I'm just gonna pull up your eye here. Okay, now I'm gonna pull down. All right, very good. Now the other side. And pull down. Okay, very good. All right, so if you can just cover up one eye really fast. Okay, very good. And now the other one. Okay, that looks good. All right, so I'm gonna get a little bit closer. I'm gonna shine a light into your eye. Just keep looking at me. You can focus on my nose if you would like. But I'm just gonna check your pupil reflexes. Okay, very good. The other side. Okay, very good. All right, I'm gonna stand back a little bit. And I want you to focus on my finger and then the back wall. Okay, focus on my finger again and the back wall. Okay, awesome, very good. Thank you. All right, so now I'm gonna get a little bit closer again. I'm just gonna use my otoscope to look closer into your eye. Okay. Okay. Now the other eye. Just double checking. Yeah. Okay, very good. It does look even and normal on both sides as well. All right, so now we're going to test your cranial nerves, and we're going to start with the first one, which is your sense of smell, or your olfactory cranial nerve. What I want you to do is I want you to close your eyes in a minute, and I'm going to put up 2 different smells to your nose, and after each one, I want you to tell me what you smell, okay? So go ahead and close your eyes. Very good. Okay, what's that smell? Lemon. Very good, very good. Okay, keep your eyes closed. And tell me what you smell. Peppermint. Very good, very good. Okay, so your first cranial nerve is intact. So the second one we will test is your vision. And so we kind of tested your vision already before, but we're just going to do a couple of other ones so that we can see your cranial nerve 2, 3, 4, and 6 are intact. So, but the first test that we'll do for your vision is what we call the H finger test. So if you can just follow my finger. Okay, awesome, very good. And then the next one is going to be your peripheral vision that we're going to test. So I do want you to go ahead and cover up one eye. Okay, very good. And then when you see my finger wiggle and come into your peripheral, say, I see it. Very good. Very good. Very good. And let's try my other hand. Very good. Very good. Very good. Okay, now if you can cover up the other eye, we're going to do the same thing. Very good. Very good. Okay. Very good. Very good. Awesome. Okay, very good. You can put your hands down. Thank you. So that was, all of those nerves are intact. So the next one we're going to look at is your 5th cranial nerve, which is your facial nerves. So when I touch your face with the object that I have in my hand, I want you to tell me if it's sharp or dull, okay? Sharp, good. Sharp, okay. Dull, very good. Sharp, okay. Dull. Sharp. 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 Dull. Sharp. 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 Okay, very good. All right, so I'm going to use a cotton swab now, so just let me know. Just say feel it when you feel it. Okay. 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 Very good. All right, so your facial nerve, number 5, is intact. Very good. Next, we're going to test the 7th one, which is the muscles in your face. So the first muscle we're going to test is if you can raise your eyebrows for me. Okay, very good. Can you close your eyes? And then squint really, really hard. Don't allow me to open them. Okay, very good. You can open them. Can you puff out your cheeks? Okay, very good. Now smile. Can you show me the bottoms of your teeth? Okay, very good. And now frown. Okay, awesome, very good. So all of those are intact. So the next cranial nerve we'll test is your 8th one. So I'm just going to whisper into each of your ears and you'll just tell me what I said, okay? A-S. Okay, very good. M-R. Okay, Perfect, very good. And the next one, I'm just going to be rubbing my fingers together, and just let me know if you can hear it. Okay, very good. And on the other side. Okay, very good. All right, so the next hearing test I'm going to be doing is with a tuning fork. So what I'm going to do is I'm going to put it on the top of your head, and I want you to tell me if you hear it, okay? Do you hear that? Okay, very good. Okay, and now with the tuning fork, I'm going to be placing it behind your ear, and I want you to tell me when you stop hearing it, okay? You stopped? Do you hear it now? Okay, very good. Now on the other side, just tell me when you stop hearing it. Stopped hearing it. Can you hear it now? Okay, very good. All right, so that was all for your acoustic hearing test for your 8th cranial nerve, which is still very good and intact. So your next cranial nerve is your gag reflex. So I apologize in advance, but I just have this wooden stick. I'm just going to place it into your mouth, and it's going to hit the back of your throat just to make sure that your gag reflex is intact, okay? Okay, so can you open? Okay, very good. So that definitely is still intact. All right, so for your 11th cranial nerve, you can just shrug your shoulders for me. Okay, I'm going to push down. Don't let me push them down. Okay, awesome, very good. And then for the 12th one, if you can open up your mouth and stick out your tongue. Okay, and then move it side to side. Okay, very good. You can close your mouth. And then just from our examination so far, I can tell that your 5th, 7th, 10th, and 11th are all intact just because of your articulate speech, which is very good. And then really quick, I'm going to palpate your lymph nodes. So just going to touch your head again, because I didn't feel them earlier, so I think we're good there. I'm going to go under your chin here and down your neck. Okay, and then behind your neck. Okay, very, very good. And on the sides. Okay, perfect. I couldn't feel any of your lymph nodes, which is good. That means that there's no sign of infection. And then really quick, I want to check the range of motion for your neck. So if you could look down for me, and then up, perfect, to the side, and the other side, and then put your ear down on the other side. Okay, very good, very good. All right, and the last thing I want to do, I just want to check your heart rate. I want to listen to your heart to make sure that there's no murmurs or fluttering or anything like that. So I'm just going to listen to your heart, okay? Okay, very good. It sounds very normal. I didn't hear any murmuring or fluttering, so that is very good. All right, so that concludes your cranial nerve examination tonight. Everything checked out normal, and so you are very healthy and everything was intact, which is very, very good. So that is everything for this evening, and I'll put that all down in your file as well. So perfect. So yeah, I hope you have a great rest of your night, and I will see you next time you pay a visit. All right, bye-bye now.